In this video, we will see about the neurosensory system. Question number 1. An adult has a medical diagnosis of increased intracranial pressure and is being cared for on the neurology unit. The nursing care plan includes elevating the head of the bed and positioning the client's head in proper alignment. The nurse recognizes that these actions are effective because they act by making it easier for the client to breathe, preventing a Valsalva maneuver, promoting venous drainage, reducing pain. Answer is 3. Promoting venous drainage. It has been demonstrated that positioning the client with the head elevated to 30 degrees decreases ICP by promoting venous drainage from the head by gravity. Pronounced angulation of the head can obstruct venous return and increase ICP. Question number 2. A client begins to have Cheyne-Stokes respirations. This type of breathing pattern is best explained as completely irregular breathing pattern with random deep and shallow respirations, prolonged inspirations with inspiratory and or expiratory passes, rhythmic waxing and waning of both rate and depth of respiration with brief periods of interspersed depth, sustained regular rapid respirations of increased depth. Answer is 3. Rhythmic waxing and waning of both rate and depth of respiration with brief periods of interspersed depth. Rationale. Cheyne-Stokes respirations are a pattern of breathing in which phases of hyperapnea regularly alternate with apnea. The pattern waxes crescendo and wanes decrescendo. Which of the following reduces cerebral edema by constricting cerebral veins? Dexamethasone, mechanical hyperventilation, mannitol, ventriculostomy. Answer is mechanical hyperventilation. Mechanical hyperventilation to reduce the CO2 levels to 25 mmHg produces cerebral vasoconstriction and thereby decreases ICP. Next one, an adult's Glasgow Coma Scale score is indicative of coma. His score is 0, 2, 6, 10. Answer is 10. A score of 7 or less defines coma. The lowest achievable score is 3, which indicates deep coma. 15 is a perfect score. Next one. When the nurse tested an unconscious client for noxious stimuli, the client responded with decorticate rigidity or posturing. This is best described as flexion of the upper and the lower extremities into a fetal-like position, rigid extension of the upper and lower extremities and plantar flexion, complete flaccidity of both upper and lower extremities and hyperextension of the neck, flexion of the upper extremities, extension of the lower extremities and plantar flexion. Answer is 4. Flexion of the upper extremities, extension of the lower extremities and plantar flexion. Rationale. Decorticate rigidity or posturing is best described as an abnormal flexor response in the arm with extension and plantar flexion in the lower extremities. Next one. An adult male is receiving cryotherapy for repair of a detached retina. When taking a history from him, which symptoms should the nurse expect him to have? Diplopia, severe eye pain, sudden blindness, bright flashes of light. Answer is 4. Bright flashes of light. Rationale. Momentary bright flashes of light are a common symptom of retinal detachment. An adult who has a detached retina asks the nurse what may have contributed to the development of his detached retina. The nurse explains that the client at greatest risk for development of a retinal tear usually has hypertension, nearsightedness, cranial tumors, sinusitis. Answer is nearsightedness. Rationale. Myopia or nearsightedness is a predisposing factor in the development of a retinal tear. Next one. The nurse is explaining cryotherapy to a client who has a detached retina. The nurse should explain that the major purpose of cryotherapy in the treatment of detached retina is to create a scar that promotes healing, disintegrate debris in the eye, freeze small blood vessels, halt secretions of the lacrimal duct. Answer is 1. Create a scar that promotes healing. Cryotherapy is used to produce a chorioretinal adhesion or scar that allows the retina to its normal position. Next one. An adult client has a stapedectomy. Which of the following is most important for the nurse to include in the post-op care plan? Checking the gag reflex, encouraging the independence, instructing the client not to blow her nose, positioning the client on the operative side. Answer is 3. Instructing the client not to blow her nose. The client should be taught to avoid blowing the nose because this action could increase the pressure in the eustachian tube and dislodge the surgical graft. Next one. The nurse is assessing reflexes on a client. A positive Babinski's reflex is extension of the elbow and contraction of the triceps tendon, supination and flexion of the forearm, dorsiflexion of the great toe with fanning of the other toes, flexion of the arm at the antecubital fossa and contraction of the biceps. Answer is 3. Dorsiflexion of the great toe with fanning of the other toes. Rationale. It is abnormal in an adult. It signifies an upper motor neuron lesion. The response describes the Babinski's reflex. Next one. Next one. The nurse is assessing the optic nerve of a client. Which of the following is a correct method to evaluate cranial nerve 2? The optic nerve. Inspect the pupils for reaction. Test extraocular movements. Use of Snellen chart. Test for a corneal reflex. Answer 3. Use of Snellen's chart. Rationale. To correctly test cranial nerve 2, the optic nerve, use a Snellen's chart to assess the visual acuity. Next one. Which of the following tests or tools should the nurse use to assess cranial nerve 8? The acoustic nerve. Romberg, Rosenbaum chart, inspection of pupils, audiometry. Answer is 4. Audiometry. An audiometry test tests different pitches and sounds. Next one. A nurse is obtaining a Glasgow coma score on a client. The score is as best eye opening 3, best motor response 6, best verbal response 4. The nurse interprets these findings as the client opens eyes to speech, obeys verbal commands and is confused, opens eyes to pain, decorticates to pain, does not speak, opens eyes to pain, no motor response and inappropriate speech, opens eyes spontaneously, obeys verbal commands and is oriented. Answer 1. Opens eyes to speech, obeys verbal commands and is confused. Rationale. 3 points is given to opening eyes to speech. 6 points are given for obeying verbal commands related to motor response and 4 points are given for best verbal response when client is confused. Thank you. Please subscribe, like, share and comment. See you in next video.